I have Dr. Peter Preziosi with me. I guess he has to leave for another meeting. Peter, you have been working in Africa with nurses. Something that I'm very passionate about. We have also a couple in the room. But Peter, yours.
Thank you very much. And yes, Dr. Cipriano, a colleague of mine, she's president of the International Council of Nurses, and doing tremendous work around the world to promote and advance the work of nurses. So, congratulations to your leadership, and really thank you to partnering with ICN. So the organization that I lead, TruMerit, it's a global assessment and evaluation company that credentials migrating health professionals, nurses, allied health professionals as they're migrating around the world. And so I've been there for about 2.5 years, and we've recognized that we have to do a lot more to upskill the global health workforce, not only supporting them around migration, but supporting them if they want to work and live regardless in their home country or other parts of the world. But as I've heard many of you talk about the growing inequities that exist, and we're going to see more of that with digital health adoption. So what we've done is we've started to develop these point-of-care tests to support nurses, community health workers, and other allied health professionals in adopting digital health technology. So we've got a project in Rwanda, rural Rwanda. We're working in 3 villages, and we have supplied nurses that are leading and running health posts in rural villages with a device from a company called MedWand. It's a remote monitoring and examination device to evaluate patients that are coming into their health posts. So what we're finding, it's just a point of care test. We've only evaluated 500 patients with nurses. And we're finding that nurses have a lot more confidence in the evaluations that they're providing because they have a better tool available to them. They can auscultate the lung sounds, they can hear the heart rates, they have an oximeter, they have an ECG, and they're evaluating these patients and preventing them from having to go and spend a lot of money on transportation to get into the city to get healthcare. So we're replicating that now with an organization in Latin America called ProMahur. And we'll be replicating this project in Bolivia and in Guatemala, just to see what the differences will be in these different countries, to see the adoption rate, how willing are patients accepting this type of technology. But so far, in our very small test, we're finding that people are very much interested in using this technology, and the patients love it. In fact, we're hearing that patients are lining up to come to these health outposts just to test out the equipment. So we're also working in Ghana with the Ghanaian Diaspora Nurses Organization on using an AI-powered sonogram with midwives and a cardiovascular physician to detect early-stage cardiovascular disease to prevent maternal deaths. So these are the type of projects that we're working on, and we might have more information by next year. But thank you for having me here, Rajanta.
Thank you, Peter. I have always been in awe for 2 professionals, Of course, I have very high regard for doctors who have been leading the care delivery, but I'm very positive that if we empowered nurses and pharmacists with digital health, we would have much better health outcomes. There's no 2 thoughts about that.